Hey, Mr. T.
Hi there.
Good afternoon. My name is Pete. I'm the student nurse anesthetist that's going to be doing your pre-op checklist for anesthesia. Before we start, I'm just going to verify your name and date of birth. Could you state your full name for me?
Mr. T, 123191.
All right, I'm confirming that by armband. All right, so basically, I'm one of the student nurse anesthetists. I'm working with CRNAs that are going to be giving you your anesthesia during the procedure. I'll be with them in the room the whole time. They just want me to perform this pre-anesthesia checklist. Is that all right with you if I go ahead and do this?
Yes.
All right, sounds good. So our hospital is just gone paperless, so I've got this fancy iPad, so all my questions are coming off this iPad. It's just a health history. I'm going to do a brief assessment, keep your clothes on, don't worry, listen to your heart and lungs, and we'll have you on your way, okay?
Okay.
All right. So before we begin, let's see, no one's with you, so it's just you and me performing the interview, so making sure that you're okay with privacy.
Mm-hmm.
So what procedure are we doing with you?
I'm getting a right shoulder replacement.
Right, okay. And that's for the torn labrum, correct?
Yes.
Right, and which doctor is performing that?
Dr. Clark.
That's right, that's who I've got here. Do you have any allergies that you know of?
I'm allergic to Demerol.
Demerol, okay, that's good to know. Let me check that off here, because Demerol is one of the medications we actually give post-surgery, because some of the anesthesia medications we give can cause shivering. So sometimes we give Demerol to combat the shivering, but since you're allergic, I'll put that in the chart so that there's no issues there.
Okay.
Any allergies to food?
No.
Latex?
Nope.
Anything like that? Pet dander, things in the environment?
Nope.
So just the Demerol.
Mm-hmm.
Excellent. All right. Are you currently taking any medications?
No.
So no pain medications or herbal supplements or anything like
No.
that? Okay, so all clear there. Wonderful. All right, so I'm gonna ask a little bit about health history and things like that. So if I use a term that you don't understand, just ask me to repeat it. And then if you get to something you don't know, just say you don't know, okay? So to start off, have you ever had or do you have any history of heart issues, heart attack or coronary artery disease?
Nope.
All right, any hypertension?
Nope.
Any chest pain whatsoever?
Nope.
Okay, no abnormal heart rhythms that you're aware of?
Nope.
All right, so no congestive heart failure?
Nope.
Valvular disease?
Nope.
Any peripheral vascular disease that you're aware of?
Nope.
Okay, any previous cardiac surgeries?
Nope.
All right, any kidney issues, kidney failure, nothing like that?
Nope.
Awesome. Do you have any history of depression, anxiety, feeling depressed, anything like that?
Nope.
Okay, fantastic. Are you a smoker?
Nope.
All right, no smoking, no marijuana, cigarettes, vaping, anything like that?
Nope. No smoking of any kind.
Wonderful. Are you a drinker? Do you drink alcohol?
I do a little bit. Yes.
Okay, about how often do you drink?
Typically just on the weekends, so 2 days out of the week.
Okay, so about 2 days a week. Do you know about how many drinks you have when you're
6
at a time, or over the course?
Over the course of the week.
Okay, so 2 or 3 times a week, 2 or 3 drinks.
Yeah.
At most. Okay.
Mm-hmm.
All right. Any history of breathing issues like emphysema or asthma that you're aware of?
Nope.
Okay. Great. Any liver issues that you're aware of?
Nope.
Wonderful. Have you ever been diagnosed with diabetes or high blood sugar at all?
Nope.
Wonderful. Perfect work. Any infectious disease issues? Something called sepsis? Have you ever had a diagnosis of something called sepsis?
No.
All right. And then do you use any other drugs at all?
No.
All right. Wonderful. Okay. Coming down the home stretch. Any history of seizures?
Nope.
All right. Any elevated pressures in your brain that you're aware of? Like any hospitalizations for
Nope.
that? All right. So no neuro issues. Do you have any issues with reflux or heartburn?
No.
Gastric reflux? Great. And then any sickle cell anemia, bleeding issues of any kind?
Nope.
Okay. I'm going to skip the pediatric section. Have you ever had anesthesia before?
No.
Or had any kind of surgery before?
No.
Okay, cool. And then any family history of issues with anesthesia? So a father that had surgery that maybe had an issue, or mom had an issue with anesthesia?
Nope, not that I know of.
Not that you're aware of? Okay. Do you know that have they had any surgeries at all?
There have been surgeries in the past.
Okay. And no reports of anesthesia. All right. issues with anesthesia.
Yeah, no issues.
Good. Do you know in the past has it been difficult? Have you ever given blood or had blood drawn or anything like that?
I've given blood before.
Okay. Do you know if you're a hard stick, difficult to get an IV?
They can only find it on my arm. And
Right arm. All right. I'll put that down. So only right arm. And then any issues with like nausea, vomiting?
Nope.
Anything like that? All right. Sounds good there. So I think that concludes this paperwork. So are you able to, say, climb a flight of stairs or 2 flights of stairs without stopping?
Yes.
Without taking a break. All right. Great. Are you able to walk 4 blocks without stopping?
Oh, yeah.
Okay. Fantastic. So we have these markers called METs or METs, and it's like a 1 through 10 system. And if you're able to do these things, we give you a MET of 4.
Mm-hmm.
And then we have these ASA standards or ranking systems, and you're perfect health, so you get a 1, which is good. So it's kind of the opposite. 1 is good, the lower the better. All right, so now what I'm going to do is I'm just going to do a quick assessment of your airway, if that's okay. Listen to your heart and lungs.
Mm-hmm.
So let me put that over here. And just bear with me for a second. Take a breath in for me. And let it go. And in. And out. And in. Out. In. Out. In. Out. In. Out. And listen to your heart. I'm going to listen with the diaphragm and the bell, so I'm going to listen a couple times. Strong heart. If you lean forward for me a little bit or kind of scoot to the front of your chair so I can listen to your back. Breathe in for me. And exhale. And in. Exhale. In. Exhale. In. Exhale. In. Exhale. In. Exhale. In, exhale, and in. Great, exhale. All right. So I'm going to do a quick assessment of your airway, if that's all right. Wash my hands. So the first thing, if you could put your head all the way back and touch your chin to your chest, and then head to normal position. Touch your ear to move your ear to your shoulder, and now to the other side. Great. All right. I'm just going to measure the distance from your chin. Thyroid cartilage. Good. So more than 3 finger breaths, which is perfectly normal. It's actually good. So now what I'm going to have you do is I want you to try and bite your upper lip like that and get as far as you can. Great. Now open your mouth as wide as you can. Stick your tongue out for me. Great. Say ah. Ah. Perfect. And you close your mouth. Just chew like normal. All right. Fantastic. So just so you know, the surgery that we're going to be doing, or that Dr. Clark is going to be doing, we'll probably use a local anesthetic. We'll use like a block, so you won't be able to feel anything down there. Because of the location, we're probably going to have to do intubation and general anesthesia. So we will be giving you anesthesia. It's going to put you to completely to sleep. I think that's what you told Dr. Clark you wanted. When we put the breathing tube in, there is risk of chipping a tooth. We try not to do that. It's very rare that it happens, but we are putting some metal down there just to get the airway ready for the breathing tube to help open it up. So there's a slight risk of chipping a tooth. Okay? But I don't foresee there being any issues, no breathing issues. You seem to be able to have, you have good mobility with your jaw. We do this thing called a Mallampati test. It's in one of those things where we rank people 1 to 4, and you are 1, which is good. Okay. So I can see, your whole the whole upper portion of your airway. So I don't anticipate there being any issues there. Let's see, I've got all your lab work. So we're all set there. When was the last time you had anything to eat or drink?
last night.
Last night, about what time?
Probably about 6 p.m.
Okay. So 6 p.m. last night. Nothing to eat or drink since then. Great.
No.
All right. Let's see. So we got ASA 1, Allen Potty 1. Got your surgical history done. You're a Met 4. And do you have any questions for me?
Nope. I'm just ready to get this
Ready to
surgery
get
over
this
with.
thing done. Okay, I understand. Well, if you have any questions that come up, either for me or the doctor, let your nurse know. Otherwise, we're going to get you ready and we'll get this thing done, okay?
All right, great.
All right, I'll be back to take you back shortly and we'll get this thing done.
Thank you.